Once you check in for cataract surgery, the nurses at the surgery center will start instilling eye drops in your eye to dilate the pupil. An experienced anesthesiologist will meet with you to start the process of the local anesthesia. I then will come and we will take you to the laser suite if you're having laser cataract surgery. In the laser suite, we will perform the laser incisions and use the laser to soften the cataract. You will not feel any pain throughout this process and actually will be awake, so I'll walk and talk you through it. You may feel a little pressure at the time that the laser is being applied, but that's really it. We then move from the laser suite to the surgical suite, where the rest of the surgery will be done under a microscope. Again, I'll be talking through it, most of it with you. You may fall asleep for some of it, given the anesthesia, the local anesthesia. We'll have great music in the background, and the surgery itself will take about 15 minutes, and then you are taken to the recovery room after. The process is truly streamlined, and the entirety of the process takes about 2 hours or so. The next day, you'll be seen for your postoperative visit. Typically, the vision is quite good the next day. It may take about a week for fluctuations to stop, but really impressive the next day. That's a lot of hugs and happy faces the next day. Drops are started actually right after surgery, the day of surgery, and continue for several weeks, and those instructions will be shared with you the next day.